Hello, and welcome to the new and improved Time for Health. I'm still Rachel Fall, and we're still looking forward to bringing you some great shows with experts on a variety of health and wellness topics. Hope you enjoy them. As always, I really ask that you not necessarily take anything that we say as medical advice for you personally. The best thing you can do always about anything is have a conversation with your physician or your nurse practitioner. So always keep that in mind when you learn something new that you want to put into practice yourself or share with others. Keep that in mind. And today we're talking about influenza because it's flu season. Absolutely. And my guest today is Leslie Deslover, and you are the infection preventionist at Magruder Hospital.
I am, and I'm very honored to be there. I've been there for almost 3 years.
Awesome.
And you are right, it is flu season again.
It really is.
Flu and more flu
Yes.
this time of year. I'm very busy with that.
And I help with some flu clinics.
Yes.
And so I think sometimes people may not even necessarily know when we say flu what the flu is. So can you talk about flu and different kinds of flu?
Yes, I can. So at this time of year, beginning October 31st, is what we call the flu season.
Mm-hmm.
And in this season, we are talking about the respiratory flu,
Okay.
not the stomach flu.
Okay.
They're two separate things. Respiratory flu is actually a contagious virus that you breathe in, which
Okay.
causes you to then become ill from that. And you'll have more of the upper respiratory things such as sore throats, coughs, that type of thing.
Okay. So that's what we call, that's the actual
That's
influenza. Okay.
Correct. If you're looking at a different type of flu where we commonly hear the flu, that's more related to a gastrointestinal illness,
Okay.
and that means belly and intestines.
Okay.
And that's where you associate more with, sorry to say,
Vomiting and diarrhea.
exactly, and the
Okay.
nausea. And those can be caused by viruses as well, such as the norovirus, which we've all heard about,
Sure.
and then also through bacteria such as salmonella and those
Okay.
types of things.
Gotcha.
Mm-hmm.
So you talked about the difference between like a stomach flu and influenza flu.
Correct.
And kind of the symptoms of both of those.
Mm-hmm.
How serious are these? Either one of them. I guess we'll talk about influenza since it's influenza season. How serious
So
is that?
influenza, if we're talking about the upper respiratory one, it does have increased mortality with it in specific groups, ones that are immunocompromised.
Okay.
Ones that maybe have not developed immunity, which is our littles,
Okay.
or our elderly who have decreased immunities now. So those we're seeing more pediatric mortality and the more elderly mortality with that. So they are very, very serious. Those adults who are what we call immunocompetent still become very ill with it and sometimes do need hospital support to recover.
So it's not anything to be taken lightly,
No.
especially if you are a little person, a young child, or an elderly with other kinds of health issues, but also perhaps if you have family members. So if you have small children or if you take care of an elderly person or something like that, you want to be careful.
Absolutely, and the single most important thing that you can do is make sure that you're vaccinated.
Right.
That's the number one recommendation for 6 months and older, that you become vaccinated, because while we may be well and not feeling ill, we could be carrying the virus, and then again our littles and our elderly would then get exposed, especially our patients who are having, our family members, who are having respiratory things or who are maybe on chemotherapies or those types of things. We just really want to be mindful of those that are in our environment.
So a vaccine protects not just us so that we either don't get it or don't get it as badly or whatever, but also that we're not carrying it to friends and family.
Not being able to pass those 4 strains on to the people that are around us. Yes, absolutely. I always say my flu vaccine protects you and yours protects me.
Gotcha.
It's very important.
So flu vaccine is always kind of a hot topic. A lot of vaccines are, but specifically a flu vaccine. Could talk a little bit about it, like how does it work? How long does it take to build up in your system? All that kind of stuff.
So the flu vaccine is developed in a certain way. The World Health Organization has these centers, they're called GER centers, where they gather information on the vaccines.
Okay.
And they kind of look throughout the world, and then twice a year they get together and they talk about what they think are going to be the most common strains based on what they've seen in other hemispheres and things like that. So they try to look at the most common ones they're expecting to be seeing, and then they formulate their vaccines on that.
Okay.
So this year at Magruder Hospital, we are using a quadrivalent vaccine. That means that it has 2 A strands in it and 2 B strands in it. So this year, I just want to make sure that I reference this correctly. The A strain, we're getting one that's from Michigan around the year 2015, which is the H1N1.
Okay.
And I will reference that in a moment. And then another A strain, which is called the Singapore strain from, looks like 2016. And that's the H3N2.
Okay.
And again, I'll reference that. I know we heard a lot about that last year.
Okay.
And then B strain for Colorado, and then B from Phuket as well, which is actually from now more Asia as far as that goes.
Okay, gotcha.
So the way the flu vaccine works, and it's a single dose vaccine that we use, is it just injected into your arm, injects those 4 different types or different strains of the viruses, and when that happens, the immune response wakes up. So it's kind of like you are opening the lock, and now you put a key in it for those 4 things and shut it, and you cannot open it ever again, meaning you're protected.
Okay. Now I gotta ask you.
Yes.
When you say that you inject, do you inject the virus? Like, do you put? Are you giving me the flu?
I'm not giving you the flu, I promise you that.
Okay.
They're attenuated, they're not live viruses by
Okay.
any means, so they cannot replicate and give you the flu. Those 4 cannot do that.
And your body starts to ramp up an immunity to those.
Exactly, and where
Okay.
I was going then is it takes about 2 weeks.
Okay.
So recommendations now from CDC and also the AKIP, which is the Advisory Committee on Immunization Practices that works with CDC, is really wanting people to get vaccinated by the end of October now.
Okay.
Because we're seeing the flu seasons lengthen, so that by now, if you got it at the end of October, by November 15th, you'd have full immunity, and by December, you'd be fully,
Good to
immunized.
So it does take a couple of weeks
Yes.
to build up. So theoretically, if I got vaccinated today and I was around somebody who happened to have influenza already, I could still get it. But it's not because I got the shot. It's because my body had not built up the immunity yet. Is
You're
that
exactly
right?
correct.
All right.
And all those variables and those types
Sure.
of variables that we'll talk about is what kind of makes the flu vaccine a little less straightforward. What I do want to say is this: if you were to have your vaccine and then be exposed to a virus from someone else, there has been factual data showing that you'll mount a better immune response, even if it's not the same strain.
Okay.
So that's another real caveat, or I mean a real positive about making sure you get vaccinated, because as the whole season goes on, the same thing happens when you're exposed to all the different other strains as well.
Okay.
Seem to have a better immune response associated with it, even if it's not the 4 strains.
Okay. I know some people say, and that's kind of why I asked, do you give me the flu when you give the shot? And you don't. But some people will say, did it used to have the live virus? And then also there are some that have, maybe some people have a sensitivity to a preservative, some have preservatives. Is that kind of sometimes what may have happened to people in the past and they thought it was a vaccine, maybe?
Correct. There's been a lot of advances in the vaccines themselves. Obviously, when we were doing multi-dose vials years ago, we had to find a way to, or the pharmaceutical companies had to find a way to make them shelf stable. So they would put a chemical in it called thimerosal, which did have a mercury derivative in it, and that's what some people reacted to as well.
Gotcha.
Yes,
Okay.
they used to use live viruses as well, not anymore. They've learned to use the attenuated ones. So let me make a caveat with that. They do use one live virus for people who would prefer not to get shots, and that's usually done intranasally then.
Okay, with the spray. Gotcha. Okay. You mentioned that the flu vaccine is recommended for 6 months and up.
Absolutely. Pregnant women,
Okay.
breastfeeding women.
Do they, if I remember, and I'm kind of going back a few years, but when a child gets it for the first time, do they have to get it twice or half twice, or no, just 6 months and up, just get it?
And what we're using at Magruder Hospital itself just got approved. We were using one that was 3 years and older, but now the vaccine that we decided on this year, although from the same manufacturer, became approved for 6 months and older, and they just get the same injections that we do.
No, not as many complications or
No.
anything like that, just go ahead and get it.
Yep,
Okay.
exactly. Very important too, because like we said, the littles can't fight off as much.
Right. And you also mentioned the 4 strains that are in this one and 4 strains that we've had in years past. Sometimes even if they're not, even if it isn't those 4 strains that are floating through our geographic area, if it's one of them is different, that even though we're not protected necessarily against that specific strain that might be around, that we're a little bit better off than we would be?
Right. It's always good. You hope for a year when the vaccines match the virus the best. Last year, little less efficacy.
Okay.
With the H3N2, but that's a hard virus to pair with. They do something called an antigenic shift very quickly.
Gotcha.
It's where a virus and a virus change to another one, and then at that point the actual vaccine is not effective. But as I stated before, if you make sure to become vaccinated, you're protected. It seems like you do a better immune response regardless of how much they match. What I do want to bring up as a caveat this year is that I was listening to a webinar about sepsis and flu, and they're doing the H1N1 focus this year. They're believing that's what they saw more of, as opposed to the H3N2 vaccine.
Okay.
And you were talking now the Avian, more of the respiratory issues.
Okay.
H1N1s just historically pair better, vaccine to virus.
Okay.
So that's hopefully a positive that we'll
Gotcha.
see this year.
Okay. All right.
Yep.
Good deal.
Yep.
Anything else regarding does everybody have quadrivalents, or are there still trivalents out there? So that would be 3 strains, if I'm remembering correctly.
Exactly.
Okay.
And for us, we do get with the committee, basically, and also with our pharmacy, and look at what we decide what we're going to use, what type, if we're going to do quadrivalent or trivalent, which is just 3, meaning 2 A's and 1 B.
Okay.
But we've opted to do the 4 here, but there are different ones. In addition to trivalent, quadrivalent, there is the live that we talked about, which has again been approved by AKIP, the Advisory Committee on Immunization Practices for use this year.
Gotcha.
For those who do not want shots.
Okay.
Then there's a high dose,
Oh, yes.
which is something that I just refer to physicians to prescribe to their elderly patients, mostly because as you get older, as we all know, you don't mount. For elderly, they don't mount as great of an immune response, nor as long of an immune response. So they seem to need a maybe more amped up type of vaccine. But again, I just defer that to the physicians.
Right. And that's a great segue. We are going to take a quick break, and we will be right back with a little bit more on the flu. And we're back with Leslie Dislover from the hospital talking about flu, especially influenza flu. So we left off talking about the high dose flu. Is that something that you kind of mentioned maybe possibly as somebody ages? So is it anybody 65 and over should get the high dose, or how does that work?
I don't think that there's an actual number assigned to that in terms of age.
Okay.
From CDC recommendations. It has more to do with kind of your coexisting conditions.
Okay.
And that's why lots of times I would just defer that to the physician, their choices, for at least at Magruder Hospital. They'll look at what you have going on, whether it's respiratory-wise or whether it's maybe diabetes or something like that. That might determine that they want the higher dose.
Okay.
Also, like we were talking earlier, as you age, you don't amount the same immune response nor keep it for as long. So they just want to kind of put a super dose in there for those reasons.
Okay, so that's an option. And obviously the vaccine you've mentioned is is it number 1 or number 2? It's really an important thing to do to prevent influenza.
Number 1 CDC recommendation is to get the flu vaccine. Absolutely, to be vaccinated to protect yourself against those 4 strains. Because like I said, once you put the key in the lock, you can open it again, so you're protected against those 4s. And I always try to reiterate, why not take those odds?
Right.
Why not just take the 4 top ones off and protect yourself against it?
And I do have to say, I have had influenza twice. Once when I was a little bit younger and I didn't really even know about getting vaccinated for it. And it was a really horrible illness. I was in bed for 5 days. Did not shower. I didn't do anything. The aches and the fever were really unbelievable. A couple of years ago, I don't even remember if it was last year or the year before, I think it was the year before, I had gotten the vaccine, but it wasn't a match that year. I must have gotten a strain that wasn't included in the vaccine. But honestly, it was not as bad. I think I missed 3 days of work instead of 5 days of work. So, I don't really know if it's because of the vaccine or whatever, but when I hear people say you might get it not as badly, I think, well, I think that might be true.
Absolutely. There's data to support that.
I was not feeling well. I had the fever, I had the aches, but it did not last as long that time.
Definitely
so
data to
that's
support
an important thing to do.
And like I said, interestingly enough, even if it's not a match, like the 4 strains, it's just amazing to me how your body still is more protected from the other strains as well. It's amazing how the body works, actually. So
now I know one of the most other important things you can do is wash your hands.
Absolutely. So
talk about other ways that we can prevent getting the flu.
Okay, so first thing is vaccination. First recommendation, but closely followed by hand hygiene, of course.
Okay.
And also something called the T-zone, being very careful not to touch your face. And as a girl, I'm very guilty of that.
Sure.
But I mean, you're touching environments and you're directly.
Yep. Oh, sure.
So making sure you do that. Alcohol-based hand rubs, that's kind of the sanitizers that we use throughout, are #1 recommended for any of the flu viruses. It's effective against those. But hand hygiene in terms of washing, always before and after you eat, or before you eat, but before and after you use the restroom. Because you just want to get rid of those nasties that maybe hang out in the gut like that. But alcohol-based hand rubs, absolutely, anytime you think of it.
Hand washing? We have discussions sometimes at home and different places. So hot water, cold water, lots of soap, antibacterial soap. Like, what's the best? What's the ideal? Or just wash them?
Just wash them is really the point. Because what you're doing at that is just simply removing the colony counts and washing them away. So at Magruder Hospital, it's our little, ecosystem that we have there, and we do not use antibacterial hand soaps within there. And it's been effective. We don't see a lot of infections going around or things like that. Other places do opt to use antibacterials, maybe based on what their data is. The idea is just that you are performing the actual physical activity of hand washing to remove any of that, scrubbing them off. Otherwise, alcohol-based hand rubs are more effective.
Okay. If your hands are actually
visibly soiled or anything like that, then always hand
soap
washing.
and water. Okay. Now, hand sanitizers are a little different. That has to. The best would be to have a certain level of alcohol in the hand sanitizer.
Right. So the ethyl alcohol recommended 60% or above.
Okay.
By the CDC.
Okay.
You'll see ones that are closer to 70, some that are 72.
Okay.
I think in my brain, I just think, well, it's higher. But I think anything 60 and above is perfect.
Is good.
Just look
so
at the back of your bottles.
hand washing, including hand sanitizing, vaccination. Talk about some other ways. Obviously, if you're not feeling well, staying home or not hanging around.
That's a really big point that we like to hit home is, #1, if you're not feeling well, you don't know what you're carrying, you're going out into the environment and once again exposing maybe our elderly or or whoever to what you might be feeling. Also, you're more at risk too as your body's trying to fight off things from getting things from other people. So it's just a better idea to stay home until 24 hours after you have resolution of signs and symptoms or fever.
Okay.
Just kind of a rule in
24
terms of that.
hours after no fever. Okay.
I mean, I think we've all been at work and you see someone who's should clearly not be there and how we think about that. I mean, feel bad for them, but also for who they're exposing.
Right.
So, staying home with that for sure.
And then, holidays coming and all that good stuff. Sometimes, you want to stay home if you're not feeling well, but like you said, sometimes people have to come, feel like we have to come to work or you're around family at the holidays who are sick, and that's why the hand washing is so important.
Exactly, and the hand sanitizing. Another big thing is something called Cover Your Cough. It's a
Yes.
campaign that was instituted in 2004. And amongst what we call standard precautions. Those are just the things that we use to protect ourselves from others. And that has to do with making sure you're coughing appropriately, which is into your elbow, so you're not spreading. Because flus are spread by large droplets that carry 3 to 6 feet. So what you want to do is just keep them from going out into the environment. So into if you're having what we call kind of leaking, which is kind of funny, which is your nose is running or those types of things, making sure to dispose of your tissues appropriately.
Sure.
And then also performing hand hygiene after any of those activities are executed. And then another thing within our hospital setting for sure is the using of masks for people who might have respiratory symptoms. I do encourage our registration staff who are
Yeah.
very much on the front line with these people
Yeah.
coming in to just kindly suggest that they put on a
Sure.
mask. Approaching it from a level of, I'm sure if your family member were here and ill, you wouldn't want someone coughing.
Bringing germs in.
Exactly. So just to be, kind about how you nudge them. But at our hospital, you'll see those stands as
Yeah.
you walk in the door
Yeah.
with the graphic by it, just reinforcing the fact that
Sure.
we can prevent spreading that by being respectful of the Cover Your Cough campaign.
I find it, I can't remember where I was, but it was where there were adults and there were kids and people were coughing. And I think it's funny, I think kids do a great job of coughing into their elbows because I think that's kind of what has been taught.
Absolutely. 2004.
But adults, we still are kind of like, ha, ha, achoo, and then, touching the door handle and the elevator button.
My
And
father's the worst for that. I can just see it like spreading. But I agree with you. I think they've been more conditioned.
Yeah,
And
the
it's still something that we do want to educate about, though, in all of our orientations and yearly things. We
Right.
make sure to
Right.
reinforce that Cover Your Cough campaign, just to keep those droplets in,
or
in
in tissue and in the trash or down
Exactly.
the drain or whatever. So, if somebody gets the flu, is there a pill you can take to help?
There is. It's time sensitive, though.
Okay.
Preferably before 48 hours, can be given up to 72.
Oh, okay.
And it's called an antiviral. I don't know if I'm allowed to talk about any brand names at all. But
go for it.
Okay.
It's fine.
So Tamiflu is what we've kind of heard as being.
That sounds familiar.
Right, exactly. And then the FDA just approved, I think last week, it was something called Zofluza.
Oh, okay.
So now we have two.
Okay.
Used to be kind of just Tamiflu. Now we have another one too, which is great to make sure that we're allowing Tamiflu to still be effective. We're not going to wear it out. type
Gotcha.
thing,
Okay.
Definitely that. And then they also recommend for people who may not test positive, meaning loved ones around you or the people that you cohabitate with,
Okay.
if they've been exposed to someone who's positive, to be treated as well. They'll give the antiviral too, just to help them mount a response.
I think that happened when I got it. They were like, oh, maybe you might want to consider
Exactly.
giving the kid, yeah.
So but like I said, don't wait. If you're not feeling well with the flu, and you referenced how significantly ill you are when you have it. Sister-in-law told me a very, very, poignant story about it. I lost my thought about it.
Time sensitive.
Time
when
sensitive.
you start to feel.
Please, if you're starting to feel like you cannot lift your head off the bed, like you've never felt like this before in your life, you're having fevers that are causing extreme chilling, you're shaking, you're coughing, make sure you get in as soon as possible so that you can get the antiviral, so that you can help your body to fight.
So if you've had the fever and the chills and the aches for 4 or 5 days, it's a bit late to go to the doctor at that point?
It is. They probably will not prescribe them because
Okay.
it's not effective. 48 to 72. 72 is kind of the outside margin. So at that point they won't. But I still would recommend, just if you need supportive therapies, what if you're perhaps dehydrated? What
sure.
if perhaps, I don't know if you got a secondary thing while your body's trying to fight off. Maybe you've developed a pneumonia. I definitely would see your physician, but I don't know that they would prescribe.
They would prescribe that, okay. Now, you get, if you present to urgent care or doctor's office or wherever, and they do a swab and they test for the flu, do they do that all during flu season is that kind of how we know when flu season is?
Right. Depending on what a patient presents with, they'll test them all year long.
Oh, gotcha, okay.
We just don't happen to see as many cases throughout the non-flu season.
Gotcha, sure, that makes sense.
Right. But based on the number of people who are presenting, and a lot of people presented last year with influenza-like illness, it's ILI, they do testing, and then we get the results for that, of course, and then we see
Gotcha.
when it actually spikes, when we peak in the season.
Gotcha.
When we get recommendations, once the flu becomes widespread, based on what the Ohio Department of Health and other health departments look at, visitor restrictions and those types of things based on that type of thing, just to make sure that
We
we're...
have had to do that, and I'm sure other healthcare facilities have to
yes.
do, nursing homes and different places have to do restrictions, like either there's a lot of flu in the community,
Correct.
please don't bring it
Bring it in.
or we have it at the hospital or in a nursing home, and we don't want to give it
we
to you.
don't have typically a lot of influenza-associated hospitalizations at Magruder.
Okay.
But we do have, a few.
Some.
And, of course, we don't want our littles coming into that either.
Right. No, that would be really bad.
Yep.
When does it peak? Because, you think cold and flu is like December, January, but isn't it a bit later around here?
Based on the data that I had from our health department that was collated last year, we saw a peak in February.
Okay. So you get it in the fall, and that keeps you built up, and you've got a good immunity, so that when that peak time comes,
you're still covered.
You're good to go.
So if you look at beginning of October, that'll carry you through to well through February.
Awesome.
So
Thank you.
You're welcome.
All right.
Thanks for having me.
You bet. We're going to take another break, and we'll be right back. All right, one last little bit. Leslie wants to talk about something we didn't mention yet, sanitizing your environment. So talk about that real quick.
It's really important. As we talked about before, the flu is a droplet spread virus. So if you're in your home or you're in a hospital setting, there's a likelihood with talking or coughing that things could land on your environment. It's very important that you go through and sanitize whatever, or disinfect actually is the right term, with whatever type of product you want at home, whatever you usually use, and frequently doorknobs, high-touch surfaces,
Light
toilet
switches.
handles, light switches, railings, countertops, any of those horizontal surfaces that you might be touching. You might touch your T-zone and then introduce. So that's just another environmental part that's really important to be aware of.
Thank you very much.
Thank you for letting me say that.
Important topic. Not super pleasant to have the flu, so we want to do everything we can to prevent it. We talked about a lot of different things, different recommendations, but as I mentioned in the beginning, make sure you talk to your doctor, your nurse practitioner. And until I come back again with another fantastic topic, make it a great day.